Hello, this is Dr. David Bilstrom from the International Autoimmune Institute and the Autoimmune Lifestyle, and this is Did You Know? So today's clinical case scenario is going to involve infections, viral infections, other kind of infections, and what kind of havoc they can wreak on the human body. We're coming to you today from CenturyLink Stadium Arena in Boise, Idaho. And this is a good example of how the microorganisms can wreak unbelievable havoc, not just in the obvious ways, but as you see here, this place is just totally shut down. It is quiet and nobody's here. So the clinical case scenario today is you are the nurse practitioner specializing in autoimmune disease, and your new patient is a woman who actually is coming to you because you saw her daughter. She brought her daughter in, and her daughter's doing so well she thought she'd come in. So the daughter, who is 8 years of age, terrible nightmares every night, concentration issues. They were thinking about diagnosing her with ADD. She was very anxious and had asthma and some allergies, so some immune system stuff, but a lot of brainy stuff. And you did some blood work, and sure enough, you found chronic infections. You suspected it because she'd been on antibiotics a lot already in her life, disrupting the immune system. Already they'd seen ear infections and strep throat. So here you did your blood work, and she came up positive, high titers for Epstein-Barr virus, high titers for strep, Coxsackie virus, and herpes virus 6. So you started treating her with a lovely antimicrobial that you can use long term. And she is doing spectacular. She's sleeping like a baby. She's not anxious anymore. She got rid of the nightmares, and she doesn't have any concentration issues. So here's the mom that comes in, and she has Hashimoto's, and she has brain fog, and she has sleep issues, and she's got some joint pain and some anxiety as well. Now, things run in family, so you do the blood work, and she's here now for her first follow-up visit where you go over labs. And sure enough, she's got high Epstein-Barr virus titers ×2. She's got Coxsackie virus. She's got herpes virus 6, and she's got mycoplasma. And you say, well, this is really common, how these microorganisms create chronic disease. And you start to explain to her, well, did you know, right now with this COVID-19 stuff, you see a viral infection, and they have what they call a cytokine storm. It creates all this inflammation that affects multiple organ systems at the same time, but it does it more over a few days to a couple of weeks. What you have, and what we see here a lot in our office, is people that have these chronic infections, and they develop this cytokine storm, multiple organ systems involved at the same time, over years or decades. Here's your daughter, over years, all her health issues. We get rid of the infections. She feels great. Here you are with these chronic health issues, chronic infections driving the cytokine storm, multiple organ systems. As we get rid of your infections, just like we got rid of your daughter's, using a great antimicrobial that gets at viruses and bacterias and mycoplasmas and funguses and all kinds of bugs, you're going to feel a whole lot better as well. And rather than your brain fog feeling like the stadium looks right now, pretty much nothing going on, you're going to wake up and you're going to feel great, and your brain fog is good to go, as well as will turn around your Hashimoto's thyroiditis. Thank you so much. Have a nice day.